a demonstration for cough assist. Another name for it is a mechanical insufflator exsufflator. It's a type of non-invasive ventilation that removes secretions from patients with an inability to effectively cough. It gradually applies positive pressure to the airway and then rapidly changes to negative pressure. This change produces high expiratory flow, which produces the cough. There's then a pause after the negative pressure. This mimics the normal breath cycle of inspiration, expiration, and then pause. It's used for patients that can't cough due to reasons like neuromuscular disorders, where the respiratory muscles are paralysed. This also includes spinal cord injuries, muscular dystrophy, cystic fibrosis, or patients who are just simply fatigued and can't cough. Benefits of the cough assist include removal of secretions. It reduces the occurrence of respiratory infections, and it's also a non-invasive alternative to suctioning. It's easy for patients and carers to use. It can come with a face mask. There's also mouthpieces and lens that you can attach to tracheostomies. This is the cough assist machine. It can be set to manual or automatic. On automatic, these dials are to select the length of inhalation, exhalation and the pause. But I'm going to focus on manual. These dials are to indicate pressures. Normal pressures for inspiration are normally around 15 and maximum 35 to 45. And expiration is 15 to about 45, but it completely depends on the patient's tolerance and clinical status. Normally people start on the lower pressures and will work their way up, but for example if a patient's productive at pressure 25, there's no need to increase. This switch is to switch from inhalation to exhalation manually, and these dials are to select the pressures. So you start on expiration, so I'll show you turn it on. If you flick to exhalation, the pressure now is on about 15. I'm going to change it using this dial here to about 20. And check if inhalation's at 20. If it's just below, this dial is to change the inhalation pressure. So you turn that up a little bit. And inhalation should be around 20. When checking these, you need to ensure that the seal on the mask is covered. And this dial is to change the level of flow. It's normal or high. The high if a patient's, for example, with a high respiratory rate, to get sufficient air into the lungs in the small breath time that they have. Okay, so I've demonstrated what all the dials mean on the cough assist. Now I'm going to speak to Ryan to visit the patient and use the cough assist on him. Okay, so what we're going to do, Ryan, is hold this with your left hand. This is so that I can see his chest wall expansion, so I can look at his breathing and I can assess when I'm going to inhale and exhale for him using the switch. What you want to do, Ryan, is I want you to put the mask on your face with the top of it just in between your eyes on the bridge of your nose. And I want you to have a tight seal, just so that the air can't get in and out. And what I'm going to do is I'm going to turn it on before I'm going to explain what I'm going to do. So what I'm going to do is I'm going to look at your chest wall expansion and see when you're going to take your breath in, but I also want you to let me know when you're going to take your breath in, and then when you have a full breath, let me know when you're going to exhale. Then I'll give yourself a pause, and then when you're about to inhale again, I want you to let me know. And with this, I'm using signs that Ryan's given me, because only he knows what his body and lungs are going through. I'm going to time that with what I'm doing with the inhalation, exhalation and pause. I'll set the pressures at 20, negative 20 and positive 20. So it's not too strong for Ryan, so that's a good level to start at. So what you do, Ryan, is have a nice seal. Turn it on. And when you're ready, Ryan? pause. I'm timing it with Ryan. And you aim to do a cycle between 4 and 6 times. And Ryan had a breath there, just to catch his breath, if the patient needs it. And we'll stop there. And the aim is, as I said, to have 4 to 6 cycles, so repeating it about 4 or 5 times, but allowing about 20 or 30 seconds in between each time, so that the patient can get their respiratory rate back, can catch their breath if they need to, or just get used to it. And like I said earlier, if the pressure needs to be increased or decreased into the negative, then that can be done so. In a patient with a large amount of sputum, this would simulate a cough. In Ryan's case, he hasn't got any sputum on his chest, which is why there's no cough simulated.